My name is Rashana Owens, and I was recently in a car accident, and that's how I was introduced to Dr. Amer and Dr. Petticourt. In my car accident, it actually flared up an older injury. So I've had issues with my knee for about the last 4 or 5 years. I was diagnosed with arthritis and began a pain regimen within having arthritis of the knee. Uh, my mobility was totally down. Um, but again, I got in a car accident and ended up coming to see Dr. Amer and Dr. Petticourt and thought of what can we do to ease some of my pain. And I ended up doing dry needling and acupuncture pretty much as a last resort just to see what would happen. And the effects are amazing. Uh, when I first started with Dr. Amer, my knee was swollen. It always held on to some fluid. I was unable to get anywhere on time.
And we're talking about the left knee.
Yeah, my left knee.
And just to let you know, the right knee now looks actually more swollen than the left knee. This knee actually we treated, and it was probably, around this much.
And that says a lot because, again, my right knee is supposed to be the healthy knee. And now, as you can see, like with the procedure, my right knee as the healthy knee is now swollen. I'm now able to, I started walking and working out again because of the positive changes within my knee. So now I'm up to actually 3 miles. It started off with a mile and I knocked it out, no pain, couldn't believe it.
When is the last time you walked a mile?
Before it would have been 5-6 years ago.
5-6 years ago.
Yeah, before I could walk a mile. And
now you're doing 3 miles.
And now I'm doing 3 miles. So I'm pretty excited. It's been really encouraging. I really appreciate it,
How long have you had your knee pain, cruciate knee pain?
This knee pain was actually an old injury from when I was a kid, a teenager in high school. I dislocated my knee. I used to run track, and I dislocated my knee, and that pretty much killed all my athletic dreams. So.
What would you say your knee pain when you walked in, to see us?
Oh, when I came in here, I was on a scale of 1 to 10, I had to be at an 11.
And what would you say your knee pain now?
My knee pain now is pretty minimal. It's like a 1.52, and that's on a bad day.
Okay.
I quit
great.
taking my pain meds.
Yeah, that's another thing. You were taking your pain medication almost 3 times a day, right?
Yes, really 3 to 4 times a day, and that's how much pain I was in. And I was prescribed the regular arthritic, medication, gabapentin. I didn't want anything too strong because I knew I had to still function. I'm currently a student at Wright State, and I hope to graduate this December.
That's great. Well, I'm very happy that you came in and tried us, and I'm very pleased with the outcome of your therapy. We're actually going to do like a mini demonstration of how to do meniscal needling. It's not really how I do the needling, for the knee in general, but this is just a small segment of how to do the meniscus. And the idea of needling is you take these myofilament needles, they're sterile needles, you put them right through the skin all the way to the meniscus, and as you enter each layer of defense from the skin to the muscle all the way to the joint, you basically mount an immune response from the body because it's going to perceive this as a foreign substance. And now you actually basically modulate the body's defense mechanism. The body brings the blood. When the blood comes in, you bring the healing. And the old saying, you can't have inflammation without healing, but you can have inflammation without healing, but you can't have inflammation without healing. You basically directed the body's arm and healing power to heal the tissues that normally the body has not basically neglected for the past, in your case, 6-7 years. So can I have you on your back for me, please?
Sure.
I'm going to put this behind your neck.
Okay.
Put this behind your neck. treat the right one, because this actually, there's some swelling on the right one, even though this is the thing that she came in to get treated, but it's doing very, very well. Pain level is almost stabilized at 1 or 1.5. So we're actually gonna take, we're gonna needle the meniscus right around this area, or the joint line. And obviously the meniscus sits between the femur and the tibia. And you're gonna locate the patella. Patella's right here. And it sits, I'm gonna do a couple on either side. So one right here, and that's how it is. And you take it. That's it.
No pain. I didn't.
And no pain. And you take it all the way in. Obviously, if you encounter bone, that means you missed it. So, and I basically tether it all the way around. I skip a little bit where the infrapatellar tendon, but that's basically my way of doing it. And again, it's very gentle. How's that?
It's awesome. You
Not-
finished? I didn't feel it.
Yeah, so I mean, I put 4 needles and it's not painful, so that's how we do it. And one thing with the needles is they're diagnostic and therapeutic. Therapeutic, obviously, they modulate inflammation, they expedite the body's healing mechanism, they decrease pain, swelling, muscle spasm. If you put this needle right in the belly of a spastic muscle, right through the trigger point, the muscle basically, as you increase the blood flow and you vasodilate these arteries, the spastic muscles will actually loosen up. But they're diagnostic in a way that as I put the needle in, the body will mount a response and will actually hold it in. So when I, trying to get the needle out, basically, you get a lot of feedback. If you take a needle and it's, take it out very easy, that means the vasodilation had occurred and the immune response took place and it's ready to go. But, if I try to take it, like for example, I just put these needles now, see how it's like, I'm really trying to grab it and the body still hold on to it. That means this area still hasn't, the immune response hasn't taken its course yet, and the body needs, it needs a little bit more time. Now let's say 10 minutes, 15 minutes goes by and it's not ready. Usually that tells me that this area is problematic and I gotta focus on that area on my clinical workup of the patient. So that way, from now on, as the patient comes in for treatment, I could literally see what areas I really need to focus on. And when the response to the body comes in, there's 2 things happen. You have a systemic response throughout the whole body and a localized response. So I could needle an area distally or proximal to the injury, and I will help another area. So I could, somebody with, for example, a knee pain or an ankle pain, I could help an ankle pain by needling above the area or even below it. So a lot of times with knees, if the patient doesn't respond to a specific systematic localized needling, I could needle the hip, could needle the ankle, and that will help.